You may have dry eyes and not even know it. So if you have allergies and you're taking an antihistamine, that'll make it worse. One woman who's with us today, her name's Deborah Galvin. She thought that her dry eyes were because of the makeup that she was wearing. Turns out it was much worse. So to help you figure out if you have dry eye, there's a free dry eye screening. It's going to be Friday in San Marco. Dr. Kimberly Riordan with the Florida Eye Specialist is here to talk more about the symptoms and how it's diagnosed and the treatment. Dr. Riordan's here, Deborah's over there. So let's just kind of talk about the symptoms first off. You know, you think it may be something kind of silly, just, you know, at first, dry eye.
Yeah, and exactly, it sounds so simple, dry eye, but there's actually a lot more to it. And most patients, the symptom-wise, they'll complain that they might feel dry, irritated, burn, have that foreign body sensation, like they feel like something's in the eye. And a big complaint actually is tearing. And I have a lot of patients tell me, but they tear, they're not dry. That's actually a big symptom. And it actually can affect your vision too and lead to blurry vision.
Dr. Riordan, I wear contacts. I know a lot of people wear contacts. Do we have different symptoms?
Not necessarily, it can be the same. And a big dry eye symptom with contact lens wearers is contact lens intolerance. You start to not want to wear them, or you can't wear them as long. And so people think it might be the contact lens, but it might actually be the eye itself.
So Deborah, you know, you thought it was makeup. Turns out to be much worse. When did you say, okay, enough is enough, this really isn't right, I need to go get checked out?
What happened, it really became the norm. It just very slowly came on, and I thought, well, this is, you know, this is the way it is. So my eyes would be stinging by the end of the day, you know, pressing on the eyelids, and it just, you know, it was just aggravating, irritating, and literally sandiness in the eyes. So I really felt like I need a shower to start this day again.
Wow.
And so when I saw Dr. Riordan, she said, you know, you have dry eyes, which I've heard that before. And they have a treatment now called LipiFlow. And she said, is that something you'd like to try? And I thought, wow, there's something I can do other than just deal with this all the time.
Before we go into that treatment, how long did you put up with this before saying enough is enough?
Several years.
Really?
Several years, yes.
Did that make the situation worse, waiting that long?
Well, we like to catch it early. The earlier you catch it, we can break that cycle of irritation. So the longer people wait and the worse your dry eye gets, severe dry eye is much more difficult to try to get under control. So the sooner we can get you treated, the easier it is.
Now let's talk about getting under control in that treatment. What does it look like? No pun intended.
So treatment, it ranges based on the type of dry eye you have and the severity. So, you know, mild treatments, lid hygiene, some artificial tears, some vitamins. And then there's also in-office treatments we can do. There's punctal plugs, there's a procedure.
It sounds painful.
It's not at all. There's this little tiny plugs we actually put into the tear ducts that allows healthy tears that you produce to stay on your eye longer. And then there's an in-office procedure called BlephX, where we can deep clean the eyelid margins, because a lot of people will suffer from a condition called blepharitis, which makes your dry eye worse. And then there's the LipiFlow, like she had mentioned, which helps open up your glands that help produce better tears for you, can help alleviate the symptoms.
So, Deborah, how are you feeling now?
Really great.
Okay.
I used to have red, sort of bloodshot eyes, too, that I didn't like about myself when I saw. Now my eye whites are white, and it's really nice. I don't have the tearing. I don't have the stinging. It's really which is a great thing to do, and I would recommend it. I really, really would, and I wish I hadn't waited so long.
Yeah. Thank you very much for coming on and sharing your story, Dr. Riordan. Thank you for letting everyone know. And, you know, people, you can check out Dr. Riordan and everyone else to see if you have dry eye. The free dry eye screenings, Friday, May 27th, from 8 a.m. until 5 p.m. You got to make an appointment. It's free. All you got to do is just call ahead. 904-564-2020. Again, that's Florida Eye Specialist. They're at 1325 San Marco Boulevard. When you get there, go to Suite 900. We're also going to have this on our website, news4jax.com.